watching Let's Chat.
Don't forget today, Solid Orange Drive-Thru at the Food City right down the road in St. Elmo. It's on Tennessee Avenue. You know where it is. Come get one of these shirts. We will be broadcasting a good part of our noon show live from there in conjunction with our friends from Warren and Griffin and Food City. Again, get there early. Hopefully, there'll be a crowd, and it starts at high noon. Get you one of these right here, just like this. Just like this. There you go. Nice catch, Patrick. We'll see if he, never mind. Moving ahead, we're talking with some folks from River Run Health. You've probably seen them down on Riverfront Parkway. Dr. Ty Young is here in the center, and Dr. Brad Keel. First of all, guys, good morning to you both. Give Keith Helton a whole lot of smack talk for him not showing up and doing this interview with you, okay? You tell him it's from me. He'll know what you mean. River Run Health, relatively new here in town. Tell me about it.
Well, we're, 3 years in there? I'm a year in. The primary care practice, we're on the top floor. There's River Run Health Sports Ortho is on the bottom. So it's two different practices. Primary care is up top, and we focus on just all general adult medicine.
And you guys have got an impressive facility down there. You've got a complete physical rehab department as well, correct?
Correct.
Tell me about that.
We do have physical therapy up on second floor with Brad and I, and then on our first floor we have a personal training area where we offer that to our patients as well. If patients have increasing their fitness or losing weight or just feeling better on their agenda, and we've done our part medically, then we've also got the folks that can help them train and get on an exercise plan.
Unless you all have changed things dramatically, you had more workout equipment than the YMCA and the sports barn combined. I mean, you've got a big operation down there. Yeah. Is there any type of health that you specifically focus on?
Well, Brad and I do plenty of chronic disease management for folks that have anything from high blood pressure to diabetes to lung disease, heart disease, but we also do a fair amount of preventive health, where we're just seeing people who are pretty well and don't have a lot on their plate medically, which is great. And Brad and I want to keep it that way. So we're trying to see those folks yearly and talk about preventive health and create those opportunities for conversations. A lot of us, self-included, sometimes have those habits we need to kind of put aside, and preventive health gives you time to talk about that.
And it is always better to be proactive as opposed to reactive when it comes to your health, and that's something you guys specialize in.
Yes.
Tell me about this. Preventative health, we're getting into that time of year where people get colds, coughs, they got flu coming up. What's the best thing we can do to reduce our odds of having to come see either one of you?
Vaccines. It is flu season. We offer flu vaccines. We encourage all of our patients to get their flu vaccine. Also, if you are sick, stay home. If you're sick, fevers, cough, stay away from others, wear a mask.
All right, I want to ask you this. We're going to go ahead and address the big elephant in the room here, and everybody and their brother's got an expert opinion on if I should get the COVID vaccine this year or not. Where do you guys stand on that?
I mean, the current recommendations from several national health bodies are get the vaccine, kind of regardless of age. I would definitely say if you're at risk, and that's over age 50, any chronic health conditions, you should absolutely put it on your docket. I've already had my COVID vaccine here in the last couple weeks myself, so I'm for being vaccinated and minimizing the risk that we get into the holiday this year and have a rebound of COVID. I want to be able to visit with my family. So to me, it's partially selfish.
Brad, your thoughts on that?
The same. I think if you're at high risk, you definitely need to get it. Lung disease, diabetes, advanced age, you definitely need to get it.
Sure, and you guys offer other vaccines as well, everything from pneumonia. Let's see, what else do you have? Shingles. I'm sure you cover the whole gambit on that, right?
Shingles.
If we don't, we'll send you to the pharmacy where they have it.
Right. One of the things that you guys have established a well-earned reputation for here, unlike some of the other bigger groups in town, I can call you and get in to see you pretty quickly. Some of the other groups and even some of the independent private practitioners, we can fit you in a week from this coming Wednesday. Nobody wants to hear that.
No.
What kind of time can we realistically expect when we call to make an appointment?
For established patients, we will almost always see them as an acute visit every day, the day of, if we can. I mean, depending on what's going on, we will try to make it a priority to get our established patients in. I'm pretty open for new patients right now because I am newer to the practice, but we can typically get somebody in to be seen as a new patient within a week. So
it's kind of tough when you are feeling sick, especially if you have flu-like symptoms, whether you have the flu or not. Awfully frustrating. Even if you're just moving into town, you need to go ahead and get your health care provider established, correct?
Yes.
All right. When are you guys going to come back and see us, and what's the next thing you're going to talk about?
Man, just probably more in the chronic disease management. It'd be good to talk about just some specific things that are changing out there, and as we're treating patients, we've got some novel treatments for diabetes, which are really advancing that care, so that might be a good topic for next time.
Sounds good. And you are going to smack talk Dr. Keith Helton for me, correct?
Yep. Right.
Wholeheartedly.
We'll
if I don't say it, feel free to make it up and just compound it, layer after layer after layer. Keith Helton's a good guy, as are these fine gentlemen. Dr. Bradley Keel, thank you. Dr. Ty Young, we thank you as well. Don't forget to join us coming up today, again, 12 noon, Food City, St. Elmo. The doctors here prescribe it, I'm pretty sure. And we will see you here for that. Join us for that and more on the day's top stories and what promises to be a great forecast. We'll see you here today.